Good afternoon, folks. This afternoon's topic A is robotics in elderly care or aged care. So here we go with the presentation I made for you. Sit back and enjoy, please. Okay, here we go. Robots and age tech are already being deployed to help older adults stay safer, more connected, and healthier at home. Expect companion bots like EliQ, humanoid care assistants, e.g. for GR-3, and health monitoring chat devices, e.g. Luna, to be commercially visible after CES 2026 through cost, privacy, and clinical validation in clinical validation vary widely. Quick takeaways. what they do: companionship, medication, reminders, activity prompts, basic fetch assist tasks, remote monitoring, and rehabilitation supports. Stanford News, EliQ, who's adopting surveys show many older adults are open to tech. 46% of people 80 plus view tech as an ally in health and healthy aging. AARP survey cited in Coverage magazine, where you'll see them first. Elder care facilities, pilot programs, and early consumer sales after CES demos. Comparison table. Headline age tech devices. CES 2026 highlights. Device role, key features and ability. Okay, humanoid. That's the robot, guys. Is it? Okay, face. It recognizes face recognition, conversation, AI driven, fetch assist, rehab supports, continuous check-ins, med reminders, activity suggestions, wellness program, messaging, social activities. Availability: institutional pilots, private sales by contract, consumer device health focused, commercial subscriptions widely piloted. Okay, guys, these are going to show up in care facilities first. So this is what's coming down the pike, guys. People get replaced by robots for elder care in some places. CES and reporting on devices demos and company claims. How these robots help grandma, concrete benefits, reduce loneliness, and increase engagement through conversation, games, and virtual social activities, uh, documented in pilot programs. OPB, LEO, LEQ improve adherence to care plans with reminders and passive monitoring that can alert caregivers. LEQ supported mobility and rehab via soft bots, interfaces, and assistive hardware under development. Stanford News. Risks, limitations, and trade offs. What to watch for. Cost. Advanced humanoids can be very expensive. Industry pricing reports and CES demos. Okay, privacy and data sharing. Many devices collect audio, video, and health matrix. Confirm who sees data and how it is stored. Clinical validation. Some wellness claims come from vendor studies or pilots. Look for peer-reviewed evidence for health outcomes. Acceptance. Not every older adult wants a robot. Human caregiver remains essential. Practical next steps for you in Pennsylvania. Pilot locally. Ask nearby senior centers or home health agencies if they run age tech pilots. Home health agencies if they run age tech pilots. Many programs distribute devices or trials. Evaluate privacy and cost. Request vendor privacy policies, data export options, and total cost of ownership, device, and subscription. Start small by stationary companion, ELQ style, or wearable health tracker before committing to a humanoid. Clarifying questions to tailor advice. Is your priority companionship, medical monitoring, mobility assistant, or cost control? Does grandma already use a smartphone or tablet? Would you prefer a trial, a pilot through a local agency, or direct purchase? In home robot caretakers are moving from science fiction to practical reality driven by aging populations, caregiver shortages, and rapid advances in soft robotics and AI. Here's a clear evidence based look at what this future actually holds, grounded in the latest research and reporting. What's driving the rise in home robot caregivers? Aging populations plus caregiver shortages are the primary forces accelerating development. Uh, Countries like Japan, with limited imagination and rapid aging demographics, are already adopting care bots at scale. Demand for aging in place support is rising globally, including in the US, where families want safer, more dignified home-based care. Robotics is shifting from rigid industrial machines to soft, human safe systems, establishing physical assistance like transfers, enabling physical assistance like transfers, toileting, and mobility supports. What these robots will actually do. Researchers emphasize the future home care robots won't just teach fetch items or remind people to take medication. They'll help with deeply personal tasks that many older adults prefer not to receive from human caregivers. Core capabilities emerging now: assistance with self care, bathing, toileting, getting out in and out of bed, mobility and safety monitoring, including fall detection and gait analysis. The Ruli robots, companionship and cognitive engagement, especially for people with dementia, integration with smart home systems to adjust lighting, temperatures, and communicate with human caregivers. The technology making this possible. Soft robotics. Uses flexible materials, rubber fabric, instead of rigid metal, designed to safely interact with the human body while providing strength and stability. A major focus of Dr. Allison Oak. Okama. Okama's work at Stanford. AI plus machine learning enables robots to respond to unpredictable real-world situations. Essential, essential in caregiving, supports natural conversation, emotional regulation, and adaptive assistance. Human robot collaboration models. Robots won't replace caregivers, they'll extend them by handling routine or physically demanding tasks. Early pilots, e.g., Judson Sr. living in Cleveland, show robots can provide continuous updates to human staff. Global momentum. Countries are experimenting with different models. Japan, Pero, steel robot. Good for dementia care, support calming aggression. ELQ, companionship, mobility, monitoring, and reminders. That's US, folks. France, buddy robots, social connection and reminders. South Korea, hydro doll, emotion recognition and engagement. These examples illustrate that robot caregivers are already real in real homes, not just labs. Benefits versus concerns. Benefits, dignity. Many older adults prefer robotic help for intimate tasks. Safety, continuous monitoring reduces fall and health risks. Companionship, robots can reduce loneliness and support cognitive health. Caregiver relief helps families and professionals manage workload. Challenges, ethical questions. Can companionship be programmed? Cost, early models may be expensive. Acceptance, cultural attitudes vary. In Japan is more open than the US so far. Privacy, sensors, and monitoring raises data security concerns. What this means for the future of care. The most realistic near term science scenario is specialized robots, devices that do one job extremely well. Transfers, mobility, support. These could appear in homes within 5 to 10 years. Long-term vision is a general purpose in home care robot capable of assisting across many tasks, but that remains a complex engineering challenge. Okay, that's A for you guys. Let me take a break and I'll be back on with B shortly. For now, Gator Wellness, take care, folks.